everyone. I'm Mehak Dhande reporting for Heart Rhythm TV from HRX 2022. And I'm joined by Dr. Clyde Yancy, advanced heart failure and transplant cardiologist, as well as professor of medicine at Northwestern University. Dr. Yancy, welcome.
Mehak, thank you for the invitation. And what a great idea, HRX. I had to go around the room and figure out HRS, HRX, what's going on? But this is really a fun conference and a great format.
Thank you so much. Keeps the mind stimulated. And this morning we came off a really great session on health Techquity. So for our viewers and people interested in hoping to make an impact in the space, how do you define health Techquity and how should we as clinicians, innovators be thinking about it?
So I hope that you and everyone listening takes a very serious moment to think about health Techquity. This is not just a play on words, Mehak. This is a discussion about a very important intersection between technology and equity, making certain that as we introduce more technology, we don't worsen inequities. And so isn't it brilliant that a priori, at the dawn of the introduction of really user-friendly, helpful technology to enable health care, that it also enables health equity.
Absolutely. Absolutely. And I think as globally, most software designers are becoming more aware of the biases that might be existing in their algorithms for decades without them knowing, I think it's really great that we're starting off keeping that in mind as we progress in this area.
So I can take you one step further with that. Credit to the electrophysiology community for really navigating this intersection of technology and health so adroitly. But it's important that because you are so invested in these technologies, you have the ear of the software developers and the hardware platform applicators. And if we're beginning to articulate with clear language, listen, in the creation of your algorithms, you must consider the entirety of the patient population. Listen, when you build these platforms, you have to be sensitive about price points. We cannot allow at the beginning more dispersion in health equity. We need to have less dispersion. So this is a great place to initiate that conversation.
Absolutely. And this morning at your session, you asked the audience to go away with two very important words when it comes to thinking about healthcare equity, especially in the tech world. So it bears repeating. So for our viewers, could you please repeat those two words?
So again, in a very serious way, the tone on which we ended was the overarching necessity to reestablish trust across the whole portfolio.
Absolutely.
This is not specific for a given race or ethnicity or other group. It's important to say we as the persons who are purveying the knowledge and are embracing patients and engaging them in new technology, new procedures, new science, need to be trustworthy. The two messages about how we can create trust is first, listen, so we understand what the patient's needs are and we give that just due. And the second thing is identify the trusted voice. Take a deep breath, Mehak, because you and I may not be the trusted voice for certain patient communities. Find that trusted voice. It might be a caregiver, it might be a community leader, whomever it is. Find that trusted voice, incorporate them in the dialogue, and help this process of overcoming the mistrust occur in a much more palpable and expeditious manner. It will take some work, but the key words, listen to our patients and then identify the trusted voice.
Trusted voice. I think yesterday with the Omar Carter Foundation discussion, we really got into the weeds of the importance of boots on the ground, the importance of engaging with the community. I think you make an excellent point. That's really how you can identify that trusted voice. And it's not about whether we directly reach our patients today, the first time we meet them, or the more important thing is to really reach them through whatever medium is best for them. Thank you so much for joining us, Dr. Yancy, for all your experience and wisdom. We really appreciate having you here.
Thanks, Mehak, and hope this meeting continues to go as well as it is.
I hope so too. Thank you everyone for watching our segment, and we will be here for more content, so stay tuned.